And welcome to the Dr. Bob Show. We're going to be spending most of this show talking about female problems, female pelvic pain, female urinary incontinence. Do you know there's different kinds, different causes, different treatment of urinary incontinence, female urinary incontinence? Do you know that pelvic pain has several causes? We'll be talking about all of those. My guest is Dr. Jeffrey Dell. Dr. Dell is the director of the Institute of Female Pelvic Pain. Not only that, he's board certified in OBGYN. Not only that, he's board certified in urogynecology. That means he's got a specialty training in urology and gynecology together. And he's going to be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about, does repetitive, frequent bouncing to the head, trauma to the head, cause brain damage? I think most of us know the answer. And if we have time, which I doubt, we'll be talking about vaping. Is it addictive? Is it dangerous? Boy, there's a lot of information for you. You'll want to stay tuned. We're talking with Dr. Jeffrey Dell, board certified in OBGYN and the director of the Institute of Female Pelvic Pain. And we've got lots and lots of questions. Jeff, welcome to the Dr. Bob Show.
Thank you. Great to be here.
Let's start off with the bladder. Is that common? Do lots of women have bladder problems and female incontinence?
Yes, I'm glad you bring this up. Bladder dysfunction, let's say, is a very common problem. More than 50% of women during their lifetime will struggle with these problems. And the bladder really is a fairly simple organ. It's primarily involved with two things: storage of urine and emptying of that urine. And so when we talk about bladder dysfunction, it involves a problem with one of those two categories. So on the storage side of the equation, we might be having incontinence, involuntary leakage of urine with a variety of different activities.
Now, involuntary means you just leak.
Exactly, and this could happen with activity or exercise or for no reason at all.
So when people go out and run, or when they exercise, when they bounce, when they cough, when they laugh, is that the type you're talking about?
Those are all types of stress incontinence. One of the very common types that we deal with. There are some other common types of incontinence and bladder dysfunction issues as well. One in the lay press now is very commonly referred to as overactive bladder. And we kind of have two types of overactive bladder, what we call overactive bladder dry and overactive bladder wet.
What's the difference?
Urgency, frequency, patients that have overactive bladder dry might feel like they've got to go to the bathroom every 30 minutes. So some of these patients are going 20 and 30 times a day. But on the dry side of the equation, they're not leaking, they're able to get to the bathroom, but they have that strong sudden urge that makes them go so frequently it's disruptive to work and life.
So do they think they've got an infection when you say frequency, urgency? Does it sting when they urinate, anything like that?
Sometimes it can be very hard to separate out infection type symptoms from just overactive bladder. On the overactive bladder wet side of the equation, not only do these patients really struggle with urgency and frequency, but when they get a strong or sudden urge, they may not even have time to get to the bathroom. And so it's running down their leg, or it creates a puddle in the grocery store. And you can imagine that this is terribly disruptive to their quality of life. And that type of dysfunction really creates a problem for their quality of life.
Well, depends or something like that, some protective thing help them?
Well, unfortunately, an awful lot of patients are sort of just struggling with these things, with these symptoms. Wearing Depends, which is a multi-billion-dollar industry. The good news is, for an awful lot of patients, there's advances in our treatment approaches, and so many of these patients can receive help and perhaps move away from the heavy-duty diapers and pads.
Well, tell me, what is that treatment? Well, what do you do?
Well, we mentioned some of the more common types of incontinence, and so I think it's important to say that first-line therapy for stress incontinence as well as overactive bladder and urge incontinence, and those folks who have some features of both, which we call mixed incontinence, first-line therapy is strengthening the female pelvic floor muscles.
So how do you strengthen the female pelvic floor muscles? What do you do?
Well, I think most women would tell you that they've been told once or many, many times by their providers to do their Kegel exercises.
Kegel.
This was a concept developed by a German physician, Arnold Kegel, and this is very good exercise for the female pelvic floor. The problem is, most women struggle to know, are they doing the exercises correctly? Are they getting strength to the right muscles? And so it can be very challenging for them.
Is it tiring when I work muscles, they get tired?
It can be a little tiring and exhausting to the pelvic floor. So since many patients have a struggle knowing whether they're doing it right, for many years we've sent patients to physical therapists. So we've got some outstanding pelvic floor physical therapy specialists that can help the patient get strengthening of the appropriate muscles. The problem is very often this takes 16 or 18 visits spread out over 2 or 3 months. And
who's got time for that?
This is very challenging with work and life and family and schedules and so on. Fortunately, we've got some newer technology that was just released and FDA cleared earlier this year that allows patients to basically have a personalized pelvic floor assistant right at their fingertips.
So this is like your smartphone, except now you've got your personal assistants for pelvic floor muscles strengthening.
That's exactly right. So with this little insert that has some very sophisticated pressure sensors, the patient in the privacy and comfort of her own home can insert this vaginally. And then this Bluetooth to her cell phone, either her iPhone or a Galaxy smartphone, and she can literally in the comfort of her home watch on the screen as she's lifting those pelvic floor muscles. It measures the strength. It helps guide the patient if they need to work in a different way or in a different location, and they are in a very dynamic way able to see right on their smartphone what they're doing with the pelvic floor.
So this is like a Fitbit. This is the new age. This is modern technology.
This is the digital era, bringing the pelvic floor approach right to the comfort and fingertips of the patient in her own home.
So you don't have to pay for the multiple visits where you're going to physical therapy as much. You can use this device. Since this is Bluetooth, can you send the information to your doctor? Can he look and see how you've progressed? Does it have a progression?
It absolutely does, and it stores that information on the phone, and the patient can then bring this in and look at it with her physician as they look at things. And just like a Fitbit or a Versa will track your steps not only today, but help you see how you compared to yesterday or a week ago or a month ago. This stores all this information. It allows you to see, are you gaining stronger contractions and elevation in the pelvic floor muscles? How much progress have you made to what it looked like when you started a week or a month ago? It really is sophisticated technology.
Now, if somebody uses this technology and they get strengthening of the pelvic floor muscles, what does that do to incontinence?
So for many patients, particularly if we catch them on the earlier side of the equation where they're not already having to wear Depends and so on, stress incontinence for so many patients can be dramatically improved to the point where they might be able to do their exercise or aerobics or yoga or other activities and no longer leak. Similarly, patients who have struggled because of the urgency, frequency, and they're running to the bathroom all the time, they can't even go out and watch a movie without having to get up 2 times to go to the bathroom during a movie, now all of a sudden can suppress those urges because they've learned how to strengthen those pelvic floor muscles and maybe go out and something as basic and simple as watching an entire movie without having to get up and go to the bathroom now can become a reality.
Especially a movie that's funny and you laugh and you giggle and all that. So I hear ladies get together and they say, when I laugh, I have incontinence.
Yes.
Can this help that?
This can help that, and it's considered first-line therapy. Now, if patients have progressed to a more severe side of the equation, sometimes we have to go to a little bit more advanced techniques, and sometimes it requires surgery or other things.
Is Botox play a part in this?
So Botox is one of the things that we use for the overactive bladder, urge incontinence side of the equation when it's considered advanced level therapy. So first we try to strengthen the pelvic floor muscles. If that's not working, sometimes we have to go to a range of overactive bladder medications that can work to help calm that bladder down and suppress the urge. But when those things don't work, we go to advanced level therapy, and the 2 primary categories of advanced level therapy are Botox injections in the bladder, which are designed and meant to be done right in the office setting. So patients drive themselves here and home right to our office. It doesn't require going to the operating room or being put under general anesthesia. They're talking to me while we do the injections, and it takes 5 minutes.
I think this is amazing.
The other type of advanced level therapy is sometimes we have to do a surgical implant with what is like a pacemaker, but for the bladder as opposed to the heart. So this is another thing that stimulates the sacral nerve and sometimes can bring control back where we're lacking in that.
So that's the nerve that supplies the bladder, and you can stimulate that?
We can stimulate that with this little implantable pacemaker type battery that lasts for 5 to 7 years before it even has to be replaced.
So the sophistication in treating female urinary incontinence is going out the sky.
It has really come a tremendous way in the last 20 years. And so I would say for those patients who are still wearing Depends and really struggling with their quality of life, seek help. There's help out there.
And are we as good at fixing pelvic pain as we are with incontinence?
Pelvic pain is a little bigger struggle.
And that's what we're going to be talking about, pelvic pain, a little bit more of a struggle, but lots of things for you and I to learn. We're talking with Dr. Jeffrey Dell, board certified OBGYN and also board certified in urology, gynecology. Very few people in the world are boarded in urogynecology, and we've been talking about urinary incontinence, the different kinds that are there, the different kinds of treatment there. What we can do instead of Kegel exercises, you can have your own personal trainer that shows you on your iPhone exactly how you're doing, and it will give you instructions such as, I missed you yesterday, you need to get back on your exercises. Jeff, let's talk about pelvic pain, a little bit more difficult subject. I want to start off with interstitial cystitis. What's that?
Yeah, so chronic pelvic pain is something that so many women suffer with, and as you said, the chronic pain side of the equation can be a little challenging, but we'll talk about a few of the most common types or causes of chronic pelvic pain. So interstitial cystitis, which we now call painful bladder syndrome, is really kind of a chronic inflammatory condition, irritation of the lining of the bladder.
So there's definitely something wrong with interstitial cystitis.
Yes.
Because I've seen some people that said, well, they didn't feel like I really had anything major. It's a
Right.
major problem.
It's a major problem for so many patients, and it's a problem where the protective lining of the bladder is no longer protecting the patient. So urine, which is full of solutes like salt and sodium and potassium and urea, are like rubbing salt in the wound. And so these patients suffer with burning. It feels like they have a bladder infection all the time, sometimes blood in the urine, pain with intimacy, urgency, frequency, running to the bathroom all the time, sometimes treated over and over for what was suspected to be a recurrent infection, and yet if you culture the urine, many of these times they don't have any bacteria in there. And so interstitial cystitis is an awful cause of this chronic pain for so many women.
Where's the pain?
The pain is sort of front and center. I mean, they can feel it. It's behind the pubic bone. It's the lower abdomen and pelvis area. Another very common condition is endometriosis, one of the most common causes of pelvic pain in women. The endometrium is the lining of the uterus. When those cells are growing somewhere other than where they belong, like on the ovaries or the tubes or somewhere in the pelvis or abdomen, they can cause a lot of pain. Pain with intimacy, terribly painful periods, pain on the right, left, or all over the place. And interestingly, we know that in a fairly high percentage of reproductive age women who suffer with chronic pelvic pain, those two conditions can coexist. So a lot of those patients have both endometriosis and interstitial cystitis, and there's some real overlap in the types of symptoms that are caused, and so it can be tricky for the patient and even her physician to try to isolate or figure out what are the main issues going on.
So women frequently hide their discomfort, not because of being embarrassed, because they've got to take care of everybody and do everything. Does this almost incapacitate people? How bad is both interstitial cystitis and endometriosis to a female?
So in the mild forms, they can start out just being kind of a nuisance or an aggravation. And very often the patient will seek help several times, and as you say, sometimes patients end up suffering in silence because they have their family and other obligations and responsibilities that they focus on. But as these conditions progress, sometimes being left undiagnosed or untreated for a period of several years, either one of them can really become devastating to the quality of life of the patient.
Treatment for both pretty good?
So we have treatments available for all of them, sometimes hormone type therapy for endometriosis. Many times we have to do laparoscopic surgical treatment. For interstitial cystitis, there's a range of dietary modifications that we work with the patient on, sometimes drinking alkaline water, a variety of medications that we sometimes use, and sometimes we have to take these patients to the operating room to dilate or stretch the bladder.
Okay, I want to switch real quick. You and I were talking earlier about a more common than we ever thought problem that females have with pelvic pain that we're beginning to see more and more. What's it called?
Yes, we have a condition called lichen sclerosis.
Lichen sclerosis.
This is a term that most patients have never even heard of, but this is a disease, we think an autoimmune type disease, that affects females much more than males, primarily the private parts. It's the vulvar and labial tissues. In the early stages, patients might just have intense itching or irritation or maybe some mild burning, and they're frequently seen over and over by their physicians, and they are diagnosed with maybe had a yeast infection or a bacterial infection, and they get treatment after treatment. As it progresses, it can cause awful destruction from the severe inflammation, ulcers, fissures, bleeding, pain, and absolute misery for these patients if it goes on undiagnosed and untreated.
Is it dangerous if it keeps progressing?
Well, it's very dangerous to their quality of life, and more importantly, about 1% of these patients can develop squamous cell cancer of the vulvar tissue. So it is a condition that needs to be appropriately diagnosed and then followed and managed by a physician who understands the disease process. So first, the patient can try to get some relief of these symptoms, which can be devastating to their quality of life, but also to make sure that one of these more serious things doesn't develop down the road.
What's the treatment for that?
So the initial treatment would be a high-potency steroid cream that we can apply topically to reduce the inflammatory changes and try to bring some relief to that patient. One of the more novel advances that we've been able to utilize tremendously over the last few years is the same type of fractional carbon dioxide laser that plastic surgeons and dermatologists have used on the face to freshen and improve the skin quality and texture. We're now able to use that exact same laser on these highly inflamed and damaged tissues, and it seems to restore an element of tissue health that is absolutely life-changing for these patients.
I think that's the key word, life-changing. Probably got 2 minutes to talk about pelvic pain and prolapse. So when we're talking about prolapse, what does that mean?
Prolapse means we're talking about pelvic relaxation and drop or collapse of the structures in the pelvis into the space of the vagina and sometimes all the way out the opening to the outside.
So what are some of the organs that can do that?
So bladder falling down into that space we call a cystocele.
Cystocele.
Back wall of the vagina and rectum pushing forward we call a rectocele. And if the uterus is dropping down, we call that uterine prolapse. But many times if the patient's already had a previous hysterectomy and they feel an egg or a bulge in the vagina that gets worse as the day wears on and it feels like something's just gonna fall out, then the top of the vagina, we call it the vaginal vault, can drop down and have vaginal vault prolapse, and very often bowel kind of fills that space and makes it a big round egg, and we call that an enterocele.
So I think the information from that is there are several different causes, so it's not easy just to do one without fixing or knowing that the other may fill that space?
Well, the key is we've got all of these important structures: urethra, bladder, vaginal walls, rectum, possibly uterus, and the female pelvic floor. And these structures are not only anatomically related, but they're functionally related. So the key is for the doctor and the patient together to figure out what are the structures involved with the prolapse, and then once you really understand what all is involved, then a plan to try to treat that for the patient can be put in place.
Can you fix that?
In most cases we can fix that. In many cases we can do some things non-surgically. We can fit the patient with a pessary sometimes, and in many cases we have to go to more advanced therapy like surgical reconstruction.
You know, as I'm listening here, I'm saying women have the possibility of so many problems. If you've got problems with pain, prolapse, bladder dysfunction, endometriosis, no matter what it is, incontinence, get it looked at. There is a way it can be fixed. Jeffrey Dell, you're amazing. You're
Thank you.
outstanding. You're a wonderful teacher. Thank you for coming to the Dr. Bob Show.
Privileged to be here. Thank you.
Mile a minute. I hope you've taped this show because it's got more information. We just have to go over it again and again and again. But know that if you're having pelvic discomfort, that there's treatment. Now you're going to want to stay tuned because we're going to be talking about other medical problems. Number one is repetitive trauma to the head. Does it cause problems like chronic traumatic encephalopathy? Woo, that's a big word. Or vaping. Is it addictive? Can it harm your health? I hope we have time for both. You'll want to stay tuned. I want to thank Dr. Jeffrey Dell. Wonderful discussion on problems with pelvic pain, and there are a lot of possible problems. Now, questions from you, the viewer, that I think will be important, and I've got two really good ones. First one is, Dr. Bob, can repetitive head trauma cause problems with the brain and even dementia? Well, I think we've known that from our athletes, our professional athletes, that repetitive trauma to the head can cause changes in the frontal lobe of the brain that we call chronic traumatic hitting encephalopathy, problem with the brain. The biggest thing is that it's not just professional football players, but anybody that's getting repetitive knocks on the head. And so if you look at the other sports, one of the sports that causes more frequent head trauma is women's soccer. When you think about it, they do headers all the time, and they're bumping up against each other's head as well as the soccer ball. So they get repetitive bumps on the head. Think about bitty football. Think about basketball under the goal. Think about you and I playing around, thinking about hand fighting and giggling and doing all that. A lot of repetitive trauma. I think we're going to get better and better in making sure that our young athletes don't have that problem, but we need to expand our thinking on repetitive head trauma. What we see in pathology is certain areas of the brain that are specific for CTE, chronic traumatic encephalopathy, recurrent head trauma. So it's not going to be just professional football players. And so I'm seeing lots of push in society, and I am so thankful for that, that there are different sports that are cutting down purposely on head trauma. So if your child is involved in that or you're involved in that, know about the possible dangers. Be sure that you have the ability to protect yourself. Question number 2. Dr. Bob, what are the dangers of vaping? Well, I think everybody knows about vaping. They've seen people that have vaped. You hear all sorts of information. What is vaping? Well, you have a little handheld device, and then you have some liquid that's going to be superheated and will come into a steam type that you can inhale and you can blow out. Now, we see the big puffs. There's less nicotine per puff than a cigarette. There's less nicotine than a cigarette. However, it still has nicotine. And the users are beginning to know how to increase the amount of nicotine for the effects that it gives. What are the effects of nicotine? Well, it speeds up your heart rate, it elevates the blood pressure, it also increases heart rhythm problems. It also is a common cause, perhaps, of lung problems. Certainly, the nicotine damages blood vessels. It will cause cancer or precancer in almost every organ of the body. So is it dangerous? Yet. What we're seeing with vaping is people are also learning to vape with tetrahydrocannabinol, that's marijuana, and also CBD. All of those, we don't know the long-term dangerous side effects, but we also know that just the vaping, the material of the apparatus, if we inhale that into the lungs. There are now, at least as of August 2019, there's one death and there's over 300 people that have a pneumonia and have to be hospitalized. Very, very sick. Dangerous? Yes. Make your decisions. Do you want to take something that's addicting and dangerous to you? No. And you don't want your children to do it. So as we drive down the street, we see a sign frequently. It says, stop. Now, it's all the time we have for this show. Remember those 4 things we like. Number 1 is that exercise. Be sure you're exercising on a regular basis. It does so much to help you. Helps you lose weight, gives you a runner's high, makes you feel good. Exercise is so important. 7.5 hours of sleep. If you get 7.5 hours of sleep, you'll feel like dynamite the next day. If you're not getting good sleep, you perform poorly, to summarize. Eat properly, eat fruits and fibers. We all know that. Start the day off with a good breakfast. And as you go on, instead of eating more and more, eat less and less. You are what you eat. Pay attention to that. Don't eat before you go to bed. And most of all, what is it that we like on the Dr. Bob Show? That laughter in your life. You know that laughter helps the immune system. You know that laughter will help you healthier. Do you know people around you, if you laugh a lot, they'll be happier. It's a contagious thing. So get together, laugh a lot, giggle a lot, smile a lot. You'll be healthier, and you will be a lot healthier.